Okay, Allison.
Good evening. We are back for COVID conversations for Black and Brown folks. And today we are focused on the elderly, our swinging senior population. There's so much that we have to learn today. And I'm so excited about this week's guests. I think today's show is going to be excellent for COVID conversations number 7. So let me just take a second to share my screen to give you an overview of what we're looking forward to this evening. Again, talking about focus on elderly patients and how COVID is impacting them. As we know, they are at greater risk for developing COVID and complications from COVID. As usual, our moderators are Dr. Maya Williams and myself, Dr. Allison Myers. And it's important for us to highlight the fact that the total number of cases of COVID continues to grow in the United States. Unfortunately, we thought that the summertime would decrease the rates of COVID, but as we've seen, cases are continuing to rise in the Southeast as well as the Midwest, out West as well. In the United States, we are now about 4.8 million cases and growing. And unfortunately, we've crossed over 150,000 deaths. Also, unfortunately, Black Americans, we continue to be disproportionately affected by COVID-19, and we have mortality rates which are twice as high than for whites or for Asians, who actually have the lowest rates. And unfortunately, Native Americans have even worse rates than we do. And if we looked at people dying from COVID and keeping in mind that Blacks, we only make up 13% of the population, if we all died at the same rate, it would be about 18,000 Black, 6,000 Latino, 600 Indigenous, and 70 Pacific Islanders who would be left behind. Why is this happening? Well, as we know, there are things that disproportionately affect us as a people, as well as older people in our ethnic group. So, for example, lower income Black Americans have limited access to things such as fresh fruits and vegetables, good healthcare, things such as that. And Black people as a whole, we're more at risk for many illnesses compared to white Americans. And these are a lot of the illnesses that place you at greater risk for COVID. And also generation limitations may be impacting why older adults are not getting this information. So hopefully you can continue to share it once you hear this wonderful webinar this evening. Older folks are also more susceptible to the virus, and that can be exacerbated by underlying depression or anxiety, especially with all of the different economic tolls that we have been enduring lately, and the fact that many of the older population are suffering with loneliness and sadness. Also, there is a lack of being able to access things that seniors normally would have before, such as mental health services, social, religious, or community engagements, such as senior centers, are also not longer open. So it limits the amount of socialization that elderly people can undergo. People who are 50, 42% of them have severe food insecurities, which means that they're sacrificing the quality or the amount of food that they are getting because they don't have the resources to get. We would just like to say thanks again to the Black Educators Community Incorporated. Shout out to my soror, Vashti Burke, for being our co-sponsor. We also like to thank Dr. Naomi Maria, Tiffany Harmon, the Department of Medicine, the Chayor, and please feel free to follow us on Twitter at Minority Health Rate. So this evening we're in for a treat. We have 3 wonderful people. We have first Mrs. Emmeline Taylor, who is a COVID-19 survivor, as well as one of my esteemed sorors. You actually could see her journey with COVID, which was chronicled on New York Times. Unfortunately, Jules Taylor to COVID, and this clip was from that wonderful piece that was done. We also are fortunate enough to have Mr. Sean B. Henry, who's a licensed clinical social worker at the United States Department of Veterans.
Dr. Myers again?
And last
Okay, so Mrs. Emmeline Taylor, could you start by telling us about you and your husband's COVID-19 story?
Absolutely. So for us, it as March rolled around and things started to get worse in New York, we, like everybody else at our jobs, closed, told everybody to go home and work from home. So starting March 14th, we both did that. My husband is was a director, a human resources director for nonprofit in the Bronx, and he brought some files home, but not enough files. So on March 26th, he decided that he was going to go to work just for the day. Typically, he goes on the train, but that day he decided he was going to drive because he didn't want to get on the train. And he went in for 3 hours simply to exchange some files and pick up some things from work. That following Tuesday, he got a message from an employee that also had gone to work that day, so telling him that he was not feeling well, had gone to the VA, and was told to go home and quarantine. Immediately the day after, I started noticing signs of what could have been COVID um, in Jules Taylor Jr., that's my husband. He was warm, he was coughing a little bit, and that evening he lost his appetite. My husband loves his food, not generally not one to eat, so I was a little bit concerned. Thursday, gave him lunch, same thing, didn't really eat, still warm, not really wanting to, and I don't blame him. Nobody wants to say, yes, I think I've got this awful virus that on TV they're telling you people are dying from. Um, Friday, he didn't, he only ate 1/4 of a Subway sandwich. By Saturday morning, his breathing had changed. I implored him to call the doctor to see what was going on. Sunday morning, 5 a.m., he woke up still feverish, still coughing, still breathing funny. I decided that I would call our doctor at 5 a.m. The doctor said it was time to get him tested. I called to make an appointment at an urgent care and was told that he could come in on Monday. To say the least, that upset me a lot because we are in the United States of America and I had to wait 24 hours before I can get my husband tested. In the meantime, my neighbor across the street, good friend, an OBGYN, she had gotten sick when she had the virus. She was starting to feel better. I called her. She said to come borrow her oximeter, the thing you put on your finger. Um, we borrowed it, put it on Jules's finger, and he was reading was an 85. Um, I had no idea what that meant. She did. She said he has to go to the hospital or the emergency room right away. Um, we called his doctor. He agreed. That was April 5th. Just like we'd seen on TV for weeks. You couldn't go. I couldn't go in with him. Drove up. We we went to North Shore. I truly believe that God led us to North Shore University Hospital. Um, and I dropped him off at the door at about 4 in the afternoon, and that's the last time I saw him standing upright. Um, I was pretty sure that I had gotten sick as well, um, and waited to get tested. The that Monday, um, I got a call from someone saying that I could call them if I ever needed any help. Our journey, even though our journey ended not the way we wanted, I would give anything to have my husband home. But our journey was a blessing in the sense that we had so much support from the hospital, from friends. On the 8th, I got a call in the morning that my husband had gone into cardiac arrest. And thankfully, they got a pulse and he was going into the ICU. He spent the next 9 days in the ICU. But every day, I would get a call from someone in the hospital letting me know how my husband was doing. Not just a call saying he was okay or he was stable, a detailed call. And I know that was not happening with everyone else. So I truly, truly felt blessed. My amazing sorority sister, God sent her to Jules. She ended up being his endocrinologist. That was not by happenstance. I really believe God sent her to him. She would also call me and give me updates and help uplift my spirits and let me know that she'd seen him and things that of that sort. The hospital allowed me to Zoom with him so I could actually see how he was doing. I was not allowed to go and visit with him. 9 days later, on the 17th, he was extubated and they did take him off the vent. That lasted 3 days. Sunday the 19th, we had a lot of hope. We had prayers upon prayers. I created a prayer Facebook private group. Everybody on there was praying, friends were praying, and we truly felt on the 19th that he was coming out the other side. We were told they were going to move him off of the ICU, out of the ICU, and we were all extremely hopeful. 20th morning, I called in like I usually call in. The nurses were always very cheery, very happy. But when I called in, I could tell something was different. They informed me that unfortunately he was put back on the vent on the 20th of April. They told me the strangest thing I'd ever heard. They told me that his body was too tired to breathe. And unfortunately, they had to put him back on the vent for the ventilator to breathe for him. Unfortunately, the 20th started his downslope. Every day we would call in. Unfortunately, instead of things getting better, things were not getting better. Slowly over time, I was able to get them to turn his phone on for me. There was an amazing CPA there that just took phenomenal care of the two of us. I would call on his cell phone, they would answer it for me. She created a makeshift cell phone holder for me, and I was able to call in on Facebook Messenger, and they would pop the phone up, and I would spend hours and upon hours with him. And those days and those times I will treasure forever. Sometimes he could understand. He would shake his head, or he would open his eyes wide, or he would shed a tear because he could hear us talking. I would invite other family members onto the on the messenger to talk to him so he could hear our voices. About a week and a half later, he was in the hospital at that time, 23 days, and I wanted to go see him. I didn't care what they were saying. I wanted to go see him, so I asked. I always believe in asking, ask and ask, and you might just get what you're asking for. I asked, and miraculously, I was told that I could come. So on Wednesday, must have been the 29th, the 27th, I got to go see him. I was told initially I would only have 15 minutes with him. I told him I would take 3. I just wanted to be able to touch my husband. I wanted to be able to have him hear my voice. I wanted to be able to feel him. So I got dressed. I went, and again, even that was people interceding on our behalf. But when I got there and I got to speak to the doctors, I pretty much knew that my husband wasn't coming home, that he was probably going to be called home by the Lord, and that was hard. But it also gave me a peace. So I came home, and the next day I started making funeral arrangements. He was 58 years old. I was not even 52. That Friday, probably one of the lowest days that I've had. Every day I woke up, I really did my best to be positive, to keep my faith up, to believe. And that Friday was probably my lowest point when my sorority sisters of Epsilon Catholic chapter of Alpha Sorority Incorporated came down my street making a ruckus. They had a 20-car caravan, just honking their horns and bringing signs, praying, letting us know they were praying for us, letting us know that they loved us, and that just was beyond everything. That just really showed that it's important to have people that are there for you. That same Friday night, I spoke to Dr. Ford, and his lungs were pretty much shot. His kidneys started to fail. And so we said, we'll see what the weekend brings. On Sunday morning, the doctor called me and said I should come. Again, blessed, because many people did not get to be with their family members when they passed away. But I had the opportunity. I had the opportunity to call for a priest and give him last rites. I was there with him. I was able to hold his hands. I was able to be with him. He took his last breath at approximately 4 p.m. 58 years old, 29 days in the hospital. Never did I imagine. Never did I imagine. But when I left there that Wednesday night, I gave it back to God and I said, "Your will be done." He saw my husband hurting. He said he was tired of him to come home. This past Monday was already 3 months since he left us. May 3rd, 4 o'clock. This time around, it just seemed, I don't know, it was harder. It was harder. And but I am blessed. I'm blessed to have an amazing, amazing support system. I used to make the doctors laugh. I used to tell them, everybody else has a village. I have an entire army. So my Greek family, my work family, my immediate family, his job, just couldn't ask for anything else other than having my husband here. So I appreciate so much the opportunity to continue to share our story, to share what an amazing, loving, funny, that's what he thought, human being that he is. I tell people I'm still married. My husband is just in heaven. So I thank you for the opportunity.
I am so sorry for your loss. I am sending you virtual hugs and hugging you right now. And thank you so much for telling us your story, because I know that was so hard to tell us. And I'm so, I don't want to say that I'm thankful, because it sounds wrong to say that I'm thankful, but just like I admire your faith, and just like you believe in God and that everything happens for a reason, I also believe that you're here for a reason to really tell us your story. And I'm so thankful that you were able to, share that story with us. And I'm happy that you got to experience the love of your life. Like, I hope that for me, for me too, because not many people have that in life. So to have had and share those moments with the love of your life. And I was telling my mom that when I looked at your age and I looked at the age that he died, and it's like around my age now, and I'm like, wow, if I could get that much time to spend with the love of my life, I think I would have lived life.
Married, we would have been married 20 years next year.
Yes. And so I know I am so happy that you got an opportunity to spend it with him, to touch him, to tell him that you love him, to hold his hand and to see him through. And I'm so happy that you have, like such a strong support system and a network. We all need that. And especially now during this difficult time, there are not many people who have an opportunity to do that. There are not that many people, so I'm very, very, very happy for you that you were given that opportunity to do that. And just so people know, we did not pay you to say that Northwell, but I am so happy.
I owe Northwell. Everybody was amazing. I couldn't have asked for anything else. The doctors, the nurses, the PAs, the CPAs. Nope. Owe them everything.
Yeah, and that's a testament to the service that that we do at Northwell. I have the pleasure of working with these doctors, and these doctors treat the patients like their family, and that's what we need, especially now in these difficult times. So thank you very much, and we'll definitely have many more questions to ask you. But now I just want to ask Dr. Yor. You spoke about that Mrs. Taylor spoke about her husband. He started to develop symptoms, and she knew that she had to take him to the hospital. But there is research that's saying COVID-19, it's typically signaled by 3 symptoms, which is fever and incessant cough and shortness of breath. But for older adults, the age group which is at most at risk of severe complications of death for this condition may not have none of these characteristics. And how does COVID-19 present in elderly patients? And how is the COVID-19 pandemic affecting older people differently than it is affecting younger generations?
So first, I'd just like to thank Mrs. Taylor for her story. Actually, the testimonial, excuse me, is very powerful. You don't often get to hear the full story of how, the timeline of people getting symptoms, how they may have gotten the exposure itself, and also going through that whole process also. And also thinking about the caregivers that are also involved in the process as well. We also have to give them support too, because oftentimes they are providing such care that don't necessarily take care of themselves. So I'm glad to see that you're here and you're healthy and you're, taking care of yourself, and you have the strong support system that Dr. Myers had just also applauded you on as well. So thank you for that testimonial. It was very powerful, very moving. And I think people should, take the time to really ingest what you have just said also. And like Dr. Williams just mentioned also, yes, the main symptoms of COVID-19 when you're exposed or infected are typically the fever, the shortness of breath, and then the cough as well. But there was a recent study done by, I forget which journal it was in, but they had mentioned, they looked at a nursing home in Chicago, and they noticed that a third of the patients that were in the nursing home had no symptoms whatsoever. So about 37% of the people who actually had COVID-19 had no symptoms at all. Right. So it's one of those diseases where, again, even the symptoms that present are typical of all other types of viral syndromes. You have fever, you have cough, you have body aches, you may have loss of taste, loss of smell, things like that also. So it could be hepatitis, it could be HIV, it could be a number of different things. But because we're in this COVID environment, your index of suspicion has to be very, very high as well. In that sense, we have to be really looking out for those symptoms in particular, like you mentioned, the fever, the cough, and the shortness of breath in particular, to make sure that we really figure out what the symptoms are and treat them accordingly. Older adults, as some of you may or may not know, they don't always present the same way as younger folks, right? So fever in a younger person is defined as 100.4. In an older adult, and by that definition, I mean 65 and older, even 85 and older, we're talking about 99s. So even in some nursing homes, we're looking at 99.5, as a threshold for fever. So if I see my patients in the nursing home or even the geriatric side, and I notice that they have waxing and waning temperatures that are kind of hovering the 99 areas, that's my little red light to say, listen, something might be going on in this person. I really need to take a look at them more closely. So they may also not get all the typical symptoms. They may get things like a dizziness and headache, right? Or even loss of appetite. So I think you mentioned that as well, Mrs. Taylor, that your husband lost his appetite too. So for someone who loves to eat and they suddenly lose their appetite, that's also can be a red flag for them as well. And also, like I mentioned before, trouble breathing. The COVID-19 infection obviously is more dire in older adults because of different factors. They may have risk factors such as high blood pressure, diabetes, malignancy, a whole host of other what we call comorbidities or the medical problems involved also. So if you are an older person, you have all these different things already as part of your medical history. And then on top of that, you have COVID-19. It's kind of like driving a car on a quarter tank, and then the COVID-19 drains it completely. So you don't really have that much of a reserve to really mount an attack and mount a response. So you're literally trying to fight on empty, pretty much. And if you have something like asthma or COPD, your lungs are already damaged. So then that causes even more insult to your lungs and causes even more problems. And that's what really makes it more difficult for the older adults to kind of fight too. And then if you also talk about malnutrition or poor diet, then you have a whole host of other issues going on there as well.
Thank you, Dr. Yaw. Mr. Henry, with everything that Dr. Yaw mentioned, with all the comorbidities and all the people having so much to worry about, the social isolation, the loneliness, the not being able to move and go outside, they could have now be experiencing a lot of anxiety and depression, as well as just overall uncertainty about what's going to happen to them. And they might be wondering, am I going to die? Am I going to share it with my family? Is my family going to give it to me? And so the mental strain on them is very, very high, as I can imagine. What do you suggest that we as caregivers can do to take care of our family members who are going through this right now? And what can the older generation do, if they're listening right now, to take care of their mental health?
So what I suggest is that we be familiar with what mental health looks like, same way that we, look at our physical health. So, we need to be aware of the symptoms to look out for. especially depression. We know that with older adults, there is already a weakened immune system. And stress actually causes even less immunity. So we want to make sure that they're not isolating. People tend to isolate when they're stressed, so we want to focus on that. We also want to, just realize that they've experienced things in their lives, and there is something called resilience. So oftentimes we tend to underscore that and feel that they need a bit more cradling than they usually do, when it oftentimes is just more involvement and allowing them to be a part of discussions, being connected. Um, you know, Relationships are important, and that's something that we need to really focus on and strengthen nowadays, especially with physical isolation. I hate to call it social isolation because we don't want to socially isolate. We want to physically isolate, but we still want to remain socially connected. So we definitely want to make sure that we're still connecting with them. We're involving them in discussions about their health, about their choices. We want to also make sure that we take a look at their health as a holistic entity. So we want to focus on their spiritual health. We want to focus on their surroundings. Oftentimes, people may live in clutter, and this can affect your mental health. Also, we want to focus on what they're eating. Oftentimes, they will be snacking because on unhealthy foods, and this may be affecting their moods. So we want to be conscious and aware of all these things. We want to make sure that they're getting some sort of physical movement, exercise, even if it's just getting outside in the yard and taking a little walk, or even sitting outside with some fresh air. There's a huge impact with nature, being able to see the trees and the animals and the birds. These are all things that we don't necessarily pay attention to and realize that it can impact mental health. But we want to be aware of all these things and try to encourage them to do these things and get out of the isolation.
Thank you, Mr. Henry. I think those are very wonderful points. And I just want to ask Mrs. Taylor, she prayed and she had the strong social support network, but what did she do during this difficult time and up until now to take care of your mental health?
I would say the three biggest things. One is absolutely prayer. I pray constantly. In the beginning, sleeping was very difficult. Going to sleep and just being able to calm my spirit. So I would say absolutely prayer. The second, I would say having people, even during this pandemic, my driveway became a place for friends to come and just sit and be with me. So even though people couldn't come into the house and be with me, my friends would come. They'd bring their beach chairs. They'd come in the morning. We'd have breakfast together outside. They'd come in the afternoon, and we'd just sit outside and work. I would go to my backyard. They'd bring their work. I would do my work. Having somebody around, because as Mr. Henry just mentioned, I could not imagine having to be in the house, in our home, for 24 hours a day by myself, not having other people to talk to cry with, and to just, even if we were just doing our own work, just to be around. And the third one, as strange as it sounds, was talking about him, talking about how wonderful he was, how funny he was, telling stories. It just, even though it was absolutely sad, helped me to remember the good times and not focus on the fact that he was just gone. So those are the three things that I would say is have faith, find good people to come and whether they sit in their car and you stand on your stoop, whatever it may be, but coming and socializing with you. And then just having the courage, if you can, to speak about the person and how wonderful they were.
So I just want to take a minute to just show you how amazing Miss Taylor is. So even though she was, I just want to show you what she came and did for us at the hospital. So as you can see here, Emmeline came. She with in there to help to take care of Mr. Taylor. So I just want to say thank you so much, Mrs. Taylor. As a healthcare provider, it was very, we were very appreciative of all that you did despite what you were going through. And it actually helped me a lot because I had a hard time processing the amount of people that I saw pass away. And I especially was very upset because it was looking like that Mr. Taylor was turning a corner. And then once he got reintubated, unfortunately that was it. So I just want to say thank you so much on behalf of the staff at North Shore for all that you did for us and how appreciative you were. And it just really made the process so much more easy. And it never really was easy.
And I actually would love to speak to that, Dr. Myers. I absolutely understand that it can't be easy. I lived it. I'm speaking from experience. When we have a loved one in the hospital and we find that we can't do the regular things that we used to do, we can't get in to go see them. We also have to remember, as Dr. Myers said, we are worrying about our one loved one. They have to deal with everybody's loved ones. So when we call in, when we have a question, understand that they're also dealing with the stress. Call and be compassionate. I can't tell you the number of times that the doctors said to me, Mrs. Taylor, you're so nice. But I wasn't doing anything special. When they said, how are you? I asked them back how they were. They're human too. They're people too. But I think at times when people are upset and somebody might say, how are you? Then they won't ask the person how they feel. Every single time I hung up the phone, I wished them well. I thanked them for coming in, for leaving their families, and for risking their lives, basically. Those little things make such a difference. On May 3rd, when my husband passed away, and I was in that room, Dr. Ford came in, you could just tell he felt defeated. He felt like he had failed my family and I. And he came in and he looked at me and he said, are you ready? Meaning they're going to come in and take the tube out. And my husband will probably die. Am I ready? I mean, who's ready for that? No one's ready for that. And he said, Ms. Taylor, we tried our best. And I stopped him. I said, Dr. Ford, please don't say you tried your best. You all didn't try. You all did your best. You all, for 29 days, you all did everything you had. I tell everyone, and again, Dr. Williams is not paying me, neither is North Shore. I tell everyone, if I brought my husband anywhere else on 2 weeks or less, he would have been dead. He would have been dead. My husband, unfortunately, as Dr. Yaw said, he had those underlying conditions. He had high blood pressure. He was borderline diabetes. He was heavy, but he was working on it. He had lost 65 pounds, and he was working on getting healthy. So when I said to Dr. Ford, don't say that you tried. You all did your very best. You could see him immediately just get a little bit of himself back. And that makes such a difference. So the thing I would say to everyone listening and everyone who may listen to a recording in the future is please keep in mind the people that take care of your loved ones. Treat them with kindness and respect and pray for them. Because at the end of the day, you're leaving your loved one in their hands. And they're human too. Thank you, Dr.
Mr. Henry, Mrs. Taylor raises a very valid point. Sometimes people don't extend grace to healthcare workers, and at the same time, they don't extend grace to themselves, especially being caregivers of elderly patients right now. So, what challenges has COVID-19 raised for family caregivers of older adults, and what can caregivers do to avoid caregiver burnout during this pandemic?
I think that caregivers should first and foremost be aware of the prejudice of ageism. We tend to compartmentalize older adults and say that they're limited in certain things that because of their age. But we should always make sure that we involve them in any discussions, any activities as much as possible. As far as burnout, I think, Ms. Taylor was mentioning just memories and things that connect her to her husband. There's something called spiritual anchors. And anchor is similar to like a boat anchor. It helps to keep a boat attached to one place. So spiritual anchors actually something that can help keep us grounded and connected to what matters most, and and be able to cope with challenges that bring. So it reminds us of what gives us meaning in life, and that there's something bigger than us, right? Which are two main components of spirituality. So a spiritual anchor can be many things. It may be an object, such as a piece of jewelry or artwork. It may be a song or a poem or a picture. It may also be a meditation practice, such as paying attention to the breath. And I think that's something that we don't pay enough attention to, the breath. And for those who are religious, it may be a religious symbol or object, such as a cross or a prayer. But I definitely want to bring it back to the breath, because I think that's something that we all have, fortunately, right now, and we don't necessarily pay attention to it enough. So simple breathing exercises. There's something called square breathing, which is just breathing in for 4 count, holding for a 4 count, breathing out for a 4 count. Simple things like that can actually help to bring down the body's fight or flight and system, right? So practicing little exercises like that of breathing can help caregivers with their burnout, can help the adults that are dealing with COVID or COVID situations, just to kind of relieve that anxiety, just focusing on that breath. And that's a simple exercise and something that we can all do anywhere at any point.
Thank you for that. I hope members of the audience, they were breathing in and breathing out, as suggested by you. This question is for Dr. Yao. Earlier, when Mr. Henry started speaking, he mentioned about ageism. And we know that members of the Black and Brown community, we have so many issues that we have to face, so many racial, distress, or everything that's going on with us, distress for the health system. So how has the pandemic exacerbated the health disparities for older racial and ethnic minorities?
Well, I want to echo what Mr. Henry just mentioned as well about ageism. And one of the things that we've also noticed is that there's been a huge spike, at least as reported by the World Health Organization, that there's been a huge spike in the amount of violence towards older adults. And by violence, I'm really talking about, physical, sexual, verbal, financial abuse as well. So we really have to be cognizant of these things. As you know, our older adults, many of them may not be fully independent. They may be dependent on family members or the caregivers to take care of them in order to do things that we call ADLs, which are things like bathing, dressing, cooking, things like that. or even what they call IADLs. Those are things like making appointments, setting up the medications, making pill boxes, so they can take their medications on time. Doing your checkbook, paying your bills, right? Because even in the pandemic, you have to pay your bills. And if you're sick or can't go outside to get food or can't have someone come to the home to take care of you, then you may not be able to do it yourself. A lot of people, it's unfortunate, I have cases where the younger people in the household have become ill, and the older adult who also may have a little bit of dementia is now left kind of to fend for themselves also. So what do you do in that situation, right? In terms of health disparities, I would say that all the health disparities that were there prior to COVID that we were talking about, that we paid some attention to, have all been exposed and exacerbated during this time. And it's to the degree where it's just blatant. They talk about how African Americans and Hispanic Americans are the ones who are affected the most because of COVID-19. We're the the face of the healthcare system, right? Our nurses, our EMS folks, all the frontline staff look like us. And they are also part of the caregiving workforce. So if you're busy working all day, taking care of other people's families, then you can't take care of the family that is at home waiting for you also. If you become ill, then you can't take care of them as well. I don't want to put everything on race, because health disparities are really about lack of resources, lack of access to resources, right? You could have, your neighborhood could have the best health system, but if the bus that takes you from your house doesn't get to that hospital, then you have no access. If you don't have the insurance money to be able to go to the hospital, utilize their services, you don't have access. And that's all the things that we're facing right now. And people are recognizing that their jobs are directly, their health insurance are directly connected to their jobs. And now that we're in this COVID environment, as people are being laid off, people are being furloughed, they don't have any jobs to go back to, how can they have health insurance in that situation, right? And then we have these stimulus checks that come out that barely pay for anything, and people may not have even gotten their stimulus checks at all. How can they continue to pay for their rent? Or are they prioritizing rent versus medicine versus food, right? If you're an older adult on a fixed income, which do you prioritize? Where you live, keep a roof over your head, buying food to keep food in your belly, or medicines to make sure that you continue to take the treatments that you need to keep yourself healthy. So the health disparities are being completely exposed right now, and they need to be really looked at and figure out ways that we can give our older adults better access to more resources. And that's something that on the ground level for physicians or even healthcare workers is difficult to manage, even without COVID-19. We've depended a lot on our social work staff to kind of help us find other resources. But even in this environment, it's all kind of hands on deck, and we're all looking to find out or figure out ways that we can really provide services to our older adults and our patients in general. And it's a difficult task, because even now, as municipalities are not getting the tax revenue from work, what's going to happen in the next year or 2 years when there's not enough revenue to cover all these different services that are out there that are needed also? So these are things that we actively have to keep thinking about. It's not just right now. It's not even yesterday. It's what's going to happen in the future, because we're talking about a vaccine in August or even in 2021. And we're talking about opening schools, but how can we do all these different things if we don't even address all the current issues that are going on right now? And I think those are things we really need to worry about and really keep an eye out for.
I think that's a very valid point. And I have started thinking about these things, because it's not always easy. I know sitting in, I would want to say boardrooms or whatever, and still advocating like, hey, Black and brown people, they are really, we're really out there, we're really dying, we're out on the streets, we're the employees. I know I have two of my favorite people in the world are actually out there on the streets, constantly working, because they are essential workers. And I always have to worry, is this the day that they get, COVID-19? I have elderly family members who are at home, worried and sick about everything that's going on. And still, it still doesn't feel like, as much as we're advocating for the rights of our people, it still feels like it falls on deaf ears. And so when we're talking about this, it's like, what are our solutions? How do we go about fixing this? And hopefully that's why we started COVID-19 conversation, so that we could allow individuals to see like people who look like them, who actually have the valuable information and could share with them, and hopefully they could go about and share that in the communities as well. I want to go back kind of a little bit to talk about elderly abuse, because I know that's something that's very rampant, but we don't really hear about it. So could you and Mr. Henry speak a little bit more about like elderly abuse and what it looks like, and if we have a family member or if there's an elderly person who's actually going through this right now, how can they identify elderly abuse and what can they do to scale back on the elderly abuse or report elderly abuse?
Okay, so in regards to elder abuse, it's often close family members and friends to these elders that are the ones that are the perpetrators. So we definitely want to be aware that if there's some change in behavior, being aware of that change in behavior. Change in their patterns. We all have rituals, and especially with elderly, these are rituals. They're day-to-day functioning, things that they do, that they normally do. If you start to see some disruption in that, these are signs. So like we would, protect, our homes and our businesses and our money, and we want to have layers of security, and we should have layers of security for these individuals, and that should be in the form of human capital. As many people are involved that care about this individual, as many systems. So whether it be the church, whether it be the neighbors, family members that actually care and are safe, because we want to make sure that the people who are around are trustworthy. So we want to, just also notice any new relationships. That's something to look out for. If you start to see them having new friends and interacting with people that you weren't aware of in the past, ask questions. And this is also a way of kind of engaging them in conversation. Ask questions. Oh, who's that? Tell me more about this person. Find out. And if you suspect anything, Dr. Yao had mentioned, physical abuse, emotional abuse, financial abuse. That's a big one, especially with family members. With older adults, they tend to become the power of attorney, and now they have access to their accounts, and they're now making withdrawals, personal withdrawals, and now bills are not getting paid. So the individuals that they're trusting to do all these things are now exploiting them. So we want to be aware of those things as well. And if you have any suspicions, you should definitely contact the Adult Protective Services in your area. And again, if it's just a suspicion, so that they can at least come in and do an investigation and see what's going on. If nothing comes out of it, then at least you've done something. But the last thing you want to do is to ignore it, and allow it to become worse.
I have a follow-up. Mr. Henry, I'm sorry. We have a follow-up question in the chat that I wanted to address on the topic of elderly abuse, if you don't mind. And Dr. Yao, you can chat in as well as Mr. Henry. Someone says, can you talk about elderly abuse in nursing homes? What can one do if they think abuse is happening to their loved ones?
I was just about to dovetail on that also, to say that, the abuse can occur in the homes. It can occur in long-term care centers, nursing homes, and assisted living places as well. And then obviously we talk about the online scams. Again, because of COVID, there's limited visitation for our residents, right? So now they're at the mercy, quote unquote, the mercy of the staff. And I'm not saying all nursing homes and all long-term care facilities are bad, but I firmly believe that those where the family is very much involved, the family does random calls, random visits, their family members seem to get the best care. And that's my opinion. And also just based on my I guess, what I've seen. If you do suspect anything, if you go visit prior to COVID, you went to visit your family member and you notice new bruises that could not be explained by the staff. If you noticed that if a staff member walked into the room and your family member was immediately kind of isolative or afraid or kind of didn't want to speak anymore, those are kind of signs that you want to look out for. And if they notice that their room is not as tidy as it used to be, if you notice that the food comes for breakfast and then let's say you come back later at lunch and the tray is still there untouched, right? If your family member has, let's say, dementia and they can't think to go get the food themselves, or they may be, let's say, paraplegic or quadriplegic and can't reach the food, then if the tray is still sitting there, that means that no one is feeding them, right? And then you have to wonder how often does that happen in a typical week or typical month or sometime like that also. It may not be, abuse in a traditional sense, but it's still negligence, right? Because no one is paying attention. And if the person becomes malnutrition, then that's also not a good thing either, right? Because that can lead to bed sores and so on and so forth and bad health outcomes as well. So you as the caregiver, you as the family member have to be vigilant and keep an eye out for these things, especially now because we don't have the luxury of being able to go into the facility to see what's going on. Even as healthcare providers, we don't see patients in the office anymore, so we can't ask the right questions. So when you do, let's say, telehealth, for example, a simple thing that I like to do is just ask the question, simple questions like, do you have enough food? Do you feel safe in your own home? Is there anyone new in the home? Is anything bothering you that you'd like to talk about today? I'd like to try and give them the opening to kind of give me a sense of what's happening also. And with telehealth, you can do a limited physical exam. You can ask them to stand up. You can ask them to show you their body parts per se. And again, if you notice these different bruises or anything out of the ordinary, you can ask further questions as well. And like Mr. Henry said also, if you have any suspicion at all, you can call Adult Protective Services because, we are kind of mandated reporters as well. So if something does happen and you as a healthcare provider didn't, and you noticed it, but you didn't report it, then that could fall back on you as well, especially if there's a poor outcome in the end. So we all have to be very, very vigilant and keep an eye out for these different things, especially in this environment where there's really no physical ability to go into facilities or have the patient come see you in the office setting also.
Thank you. And, as we come to the end, we have a question. All of our seniors are not in nursing homes. We have plenty of people in their 70s, 80s, and 90s who are still at home and are still very active. So we have two really good questions in the Zoom chat for people who are swinging seniors in their 80s that want to get out and get mobile, who have a couple of questions, and feel free, any of our three panelists, to comment. So the first question was, can you give a little more specific actions for older people who've been at home for all 5 months? My spouse is sleeping a lot and doesn't exercise. One of our other seasoned seniors who's on the Zoom chat says, as the city is opening up, how do we continue to protect ourselves from contracting the virus? Is wearing a mask really sufficient to not participate in socially distanced events?
So the activities that are approved per se right now for everyone to follow, and to me, this is very simple. Wear your mask, socially distance, 6 feet at the least, or at the most, whichever way you want to look at it, right? And also hand hygiene frequently, right? If you want to go outside, that's fine, but you also have to kind of look at the venue you're going to. So if you're going outside with, let's say, your spouse together, one household together, and you're going to be walking together, that's one thing. That's you and your cohort walking together. If you come into contact with another person who's not in your immediate circle or in your household, then that's a secondary contact. That's where you should be wearing your mask as well at all times, or socially distancing from that person too. If you want to go out to dinner, at least here in Maryland, they say that if you want to go out to dinner, you can go out to dinner and dine in certain places, but it's only that one family that sits together. If you have friends from another neighborhood or even another house that want to come sit next to you, that's probably not a good idea because you can only account for your movements. You can't account for their movements, right? And so you want to be able to really strategically move about. We had to ask our hospital epidemiologist, one of our staff members asked about church. and she loves to sing in the choir. And the question was, do I have to wear a mask when I sing? And it's a tough question to answer. And the answer is yes. If you have to sing, or if you're on the choir, you must wear a mask, because singing involves you opening your mouth wide and you're letting out a strong voice, which can also lead to a lot of saliva coming out of your mouth. And if you're in a choir and you're all grouped together and you're all doing the same thing, you can only imagine how much viral contents are being spit out in that choir area also. So she, at the end of it, the staff member was like, well, I'll just stay home and watch the church service from my house, and also sing, in my home as well. So it's fairly inconvenient, but at this time we really need to take care and be vigilant about our health. And hopefully as time passes, there'll be adequate treatments, there'll be a vaccine. And again, I always like to stress, vaccine does not necessarily mean cure. Vaccine is just another preventative measure. It doesn't cure anything, right? So we're all putting our hopes on this vaccine, and it seems as though vaccine will just make everything wonderful and disappear. But all it really means is that we're preventing someone else from catching the virus, and hopefully that'll decrease the numbers. But we all have to be vigilant in masking, socially distancing, and also hand hygiene. Masking, socially distancing, and hand hygiene. Those are the keys that we have right now. Those are the keys that seem to have worked, especially in New York, right? And a lot of other places. Those are the keys that seem to have worked so far, because everything else that we have hasn't really been working that well. So we really just have to be vigilant in those things at all times.
I just wanted to add on just regarding the nursing homes. A lot of nursing homes are allowing visitors to come and actually see the patients through the window. So there are some nursing homes that are allowing those types of visitation. So ask, every nursing home should have a social worker. Ask for that social worker's name, put them to task, make sure that they are the liaison between you and your family member or your friend there in that nursing home. Because the more involvement, again, like Dr. Yao had mentioned, the more involvement that you have, the more oversight you can have, and the less likely abuse can occur, because they know that people are involved. So, hold that social worker to task and see if you can visit through the window or through a protected space.
And there's one last thing about your other question about activities. In terms of health, right? A lot of my patients are asking, doctor, when can I come see you in the clinic? And I said to them, right now we're focusing more on telehealth, and I'll call you. So keep in mind that when your doctor says, I'll see you next week, please make sure that they're letting you know the difference between an office visit and the telehealth visit. We've had so many people come into the clinic when it's actually been a telephone appointment and not a face-to-face appointment, right? Other thing too, people may be due for, let's say, a colonoscopy, a mammogram, or even a pelvic exam for a pap smear, things like that also. There are guidelines that kind of tell us what time frame to do these things in. In this environment, again, unless you are in the high risk category, you can likely postpone these surveillance screening tests, right? If you've never had a positive test on your mammogram or your colonoscopy or a pap smear, you can probably delay it. But this is the time to really speak to your healthcare provider and take them to task and have them answer all your questions, especially at your visits when you do go, or even if it's a telehealth visit. In regard to vaccines, we're heading into flu season, right? So for our older adults, the key vaccines that are important are the flu vaccine and also the pneumonia vaccine as well. Now, there are different ways that we can affect these things as well. You could do curbside vaccinations if your office allows for that. There could be a specialized location where they can just do vaccinations if your clinic allows for that also. But these are kind of things that you have to keep in the back of your mind, especially as you go through this time, because we don't really know how long this is going to last, right? So we just want to make sure that we kind of, again, I like to use the word stay vigilant, because that's really what it is. You have to be aware at all times of all your surroundings. Even during the Zoom, I've noticed that I've touched my face at least 6 times. And so, and luckily I'm in my house, but imagine if you're in your office and you're doing the same thing, you don't really know because you're not wiping down all the surfaces as much. And that's another routine you have to get into, wiping down your surface, especially in places where you're not used to. So we have to be vigilant at all times.
Thank you, everybody. This was such a wonderful, rich forum. And I'm sorry that I froze on you guys a couple of times, but as they say, physician heal thyself. So I'm holed up somewhere in the country. So my usual great Wi-Fi that you're used to, I'm not giving you tonight. So again, I'm sorry. So I just want to properly introduce again and thank again our panelists. So Mrs. Emmeline Taylor, you know, you have a lot of love on the chat. There's a lot of sorors and a lot of other people who are sending you well wishes and prayers. Thank you so much for telling the story. Thank you for being a soror. Thank you for being a friend. You helped me as a caregiver in my healing with the whole process. So I just want to say thank you so much. And again, thank you from all the staff at North Shore for bringing us those treats and the signs. It was above and beyond. My frat and brother, Sean Henry, licensed clinical social worker at the VA. Thank you for those jewels. That elder abuse piece was so important. A lot of people forget that elderly people, we think a lot about children, and we forget that elderly people are also very vulnerable to being victims of abuse. And that information was very valuable. And I think it's very important that we need to remember that we should be calling and putting our social workers to work. And of course, thank you, Dr. Nana Yao Adusa Darky, one of my best buddies from medical school. Thank you for being at the older population. Get some people really great, a lot. So I just want to thank all of you. And we look forward to you again in 2 weeks. We're going to go to the other end of the spectrum and look at our little people on our next chat. And then in September, we also have some really great chats. We're going to talk about financial health. So please keep checking us out. You know, Black wealth, generational wealth is something that we're very big on. So we're bringing that in September. So we look forward to seeing you guys again. And thanks again for our panel. Let's give them a hand. Great show tonight. Thank you guys.
So much. Thank you. Have a good night.
Bye-bye.